the Chamber will also issue the same announcement. Before I call the Prime Minister, I would like to point out that the British Sign Language interpretation of the statement is available to watch on parliamentarylive.tv. I now call the Prime Minister to make a statement. Boris Johnson.
Thank you very much, Mr. Speaker. And can I share your gratitude to the House Commons staff, Mr. Speaker, for all their efforts, their hard work to allow us to meet today in the way that we are. And before I begin my statement, I'd like also to say that I know the thoughts of the whole House will be with the Honourable Member for Cardiff Central, who is currently in hospital with COVID, and we wish her a full and speedy recovery. Mr. Speaker, with your permission, I'll make a statement about the measures we're taking to defeat this new variant of COVID-19, protecting our NHS whilst it carries out vaccinations that will finally free us from this wretched virus. And, Mr. Speaker, there is a fundamental difference between the regulations before the House today and the position we faced at any previous stage, because we now have the vaccines that are our means of escape. And we will use every available second of the lockdown to place this invisible shield around the elderly and the vulnerable. Already, with Pfizer and Oxford AstraZeneca combined, we have immunised over 1.1 million people in England, over 1.3 million in the UK. Our NHS is following the plan drawn up by the Joint Committee on Vaccination and Immunisation, which is aimed at saving the most lives in the fastest possible time. And given that the average age of COVID fatalities is over 80, it is significant that we've already vaccinated more than 650,000 people in this age group, meaning that within 2 to 3 weeks, almost 1 in 4 of the most vulnerable groups will all have a significant degree of immunity. By February 15th, the NHS is committed to offering a vaccination to everyone in the top 4 priority groups, including older care home residents and staff, everyone over 70, all frontline NHS and care staff, and all those who are clinically extremely vulnerable. And in working towards that target, there are already almost 1,000 vaccination centres across the country, including 595 GP-led sites, with a further 180 opening later this week, and 107 hospital sites with another 100 later this week. Next week, we will also have 7 vaccination centres opening in places such as sports stadia and exhibition centres. Pharmacies are already working with GPs to deliver the vaccine in many areas of the country, and I'm grateful to Brigadier Prosser, who is leading the efforts of our armed forces in supporting this vaccine rollout. We've already vaccinated more people in this country than in the rest of Europe combined, and we will give the House the maximum possible transparency about our acceleration of this effort, publishing daily updates online from Monday, so that jab by jab, honourable members can scrutinise the progress being made every single day. Yet, as we take this giant leap towards finally overcoming the virus and reclaiming our lives, we have to contend with the new variant, which is between 50 and 70% more contagious. The old variant, which the House agreed last month, the tiers that the House agreed last month, was working with the old variant, but alas, this mutation, spreading with frightening ease and speed, in spite of the sterling work of the British public, this mutation has led to more cases than we've seen ever before, numbers that, alas, cannot be explained away by the meteoric rise in testing. When the Office of National Statistics reports that more than 2% of the population is now infected, and when the number of patients in hospitals in England is now 40% higher than the first peak in April, it is inescapable that the facts are changing and we must change our response. And so we have no choice but to return to a national lockdown in England, with similar measures being adopted by the devolved administrations, so we can control this new variant until we can take the most likely victims out of its path with vaccines. My right honourable friend, the Secretary of State for Health, will open the debate on the full regulations shortly. But the key point, I'm afraid, is that once again we are instructing people to stay at home. everyone to stay at home, leaving only for limited reasons permitted by law, such as to shop for essentials, to work if people absolutely cannot work from home, to exercise, to seek medical assistance such as getting a COVID test, or to escape injury or harm, including domestic abuse. We're advising the clinically extremely vulnerable to begin shielding again. And because we must do everything possible to stop the spread of the disease, we've asked schools and colleges to close their doors to all except vulnerable children and those of critical workers. Mr. Speaker, I don't think the House will be any doubt about our determination, my determination, to keep schools open, especially primary schools, open for as long as possible, because all the evidence shows that school is the best place for our children. And indeed, all the evidence shows that schools are safe and that the risk posed to children by coronavirus is vanishingly small. For most children, the most dangerous part of going to school, even in the midst of a global pandemic, remains, I'm afraid, crossing the road in order to get there. But the data showed, and our scientific advisors agreed, that our efforts to contain the spread of this new variant would not be sufficient if schools continued to act as a vector or a potential vector for spreading the virus between households. Mr. Speaker, I know the whole House will join me in paying tribute to all the teachers, all the pupils and parents who are now making the rapid move to remote learning, and we will do everything possible to support that process, building on the 560,000 laptops and tablets provided last year, with over 50,000 delivered to schools on Monday and more than 100,000 being delivered in total during the first week of term. We have partnered with some of the UK's leading mobile operators to provide free mobile data to disadvantaged families to support access to education resources. And I'm very grateful to EE, 3, Tesco Mobile, Smarty, Sky Mobile, Virgin Mobile and Vodafone for supporting this offer. Oak National Academy will continue to provide video lessons, and it's very good news that the BBC is launching the biggest education programme in its history, with both primary and secondary school programmes across its platforms. We recognise it will not be possible or fair for all exams to go ahead this summer as normal, and the Education Secretary will be making a statement shortly. Mr. Speaker, I know many people will ask whether the decision on schools could have been reached sooner, and the answer is that we've been doing everything in our power to keep them open, because children's education is too vital and their futures too precious to be disrupted until every other avenue, every other option has been closed off and every other course of action has been taken. And that's why schools were the very last thing to close, as I've long promised that they would be. And when we begin to move out of lockdown, I promise that they will be the very first things to reopen. That moment may come after the February half term, although we should remain extremely cautious about the timetable ahead. And as was the case last spring, our emergence from the lockdown cocoon will not be a big bang, Mr. Speaker, but a gradual unwrapping. That is why the legislation this House will vote on later today runs until the 31st of March, not because we expect the full national lockdown to continue until then, but to allow a steady, controlled and evidence-led move down through the tiers on a regional basis, carefully, brick by brick, as it were, breaking free of our confinement, but without risking the hard-won gains that our protections have given us. These restrictions will be kept under continuous review, with a statutory requirement to review every 2 weeks and a legal obligation to remove them if they are no longer deemed necessary to limit the transmission of the virus. And for as long as restrictions are in place, we will continue to support everyone affected by them, from the continued provision of free school meals to the £4.6 billion of additional assistance for our retail, hospitality and leisure sectors announced by my right honourable friend, the Chancellor, yesterday. Mr. Speaker, we are in a tough final stretch, made only tougher by the new variant, but this country will come together. and the miracle of scientific endeavour, much of it right here in the UK, has given us not only the sight of the finish line, but a clear route to get there. After the marathon of last year, we are indeed now in a sprint, a race to vaccinate the vulnerable faster than the virus can reach them, and every needle in every arm makes a difference. As I say, we're already vaccinating faster than every comparable country, and that rate, I hope, will only increase. But if we're going to win this race for our population, we have to give our army of vaccinators the biggest head start we possibly can. And that is why, Mr. Speaker, to do that, we must once again stay at home, protect the NHS and save lives. And I commend this statement to the House.
Yeah. We now come to the Leader of the Opposition, Right Honourable Keir Starmer.
Thank you, Mr. Speaker, and can I thank the Prime Minister for advance sight of his statement and for his telephone call on Monday to update me. Can I also thank him for his kind words about the Honourable Member for Cardiff Central. She is still in hospital, but I'm happy to say that she is now improving. I also want to thank everybody on our NHS and on the front line for all the work they're doing at the moment in the most stressful of circumstances. The situation we face is clearly very serious, perhaps the darkest moment of the pandemic. The virus is out of control. Over 1 million people in England now have COVID. The number of hospital admissions is rising. Tragically, so are the numbers of people dying. And it's only the early days of January, and the NHS is under huge strain. In those circumstances, tougher restrictions are necessary. We will support them, we will vote for them, and urge everybody to comply with the new rules. Stay at home, protect the NHS, save lives. But this is not just bad luck. It's not inevitable. It follows a pattern. In the first wave of the pandemic, the government was repeatedly too slow to act. And we ended 2020 with one of the highest death tolls in Europe and the worst hit economy of major economies. In the early summer, a government report called Preparing for a Challenging Winter warned of the risk of a second wave, of the virus mutating, and of the NHS being overwhelmed. It set out the preparations the government needed to take. I put that report to the Prime Minister at PMQs in July. Throughout the autumn, track and trace didn't work. Sage advised a circuit break in September, but the Prime Minister delayed for weeks before acting. We had a tiered system that didn't work. And then we had the debacle of the delayed decision to change the rules on mixing at Christmas. The most recent advice about the situation we're now in was given on the 22nd of December, but no action was taken for 2 weeks until Monday of this week. Mr. Speaker, these are the decisions that have led us to the position we are now in. And the vaccine is now the only way out. And we must all support the national effort to get it rolled out as quickly as possible. We will do whatever we can to support the government on this. We were the first country to get the vaccine. Let's be the first country to roll out that vaccine programme. But we need a plan to work to. The Prime Minister has given some indication in the last few days, but can he tell the House exactly what the plan is? Can the NHS deliver 2 million vaccines a week? I think they can. I hope they can. But do they have the resources and support to do so? And we will support that, of course. Will there be sufficient doses available week on week to get us to the 14 million doses by mid-February? What can we do to help? It's vital that that happens. I'm glad to hear that high street pharmacies will be helping. Can we use volunteers in support of this national effort? Let me turn to financial support. Yesterday's announcement will help, but the British Chamber of Commerce and others have already warned it's not enough. There are big gaps and big questions. First, why is there still nothing to help the 3 million self-employed who've been excluded from the very start? That was unfair in March of last year. It was even more unfair in the autumn. It's totally unforgivable now. It may well be a whole year that that group have gone without any meaningful support. That gap needs to be plugged. Secondly, will the Prime Minister drop his plan to cut universal credit by £20 a week? That needs to be done now, and we will support it. Will he immediately extend the eviction ban? That's due to run out just in 5 days' time now, just as we're going into this new phase. Third, will he address the obvious issues with financial support for those required to isolate, including statutory sick pay and support for local councils? And will the Prime Minister finally recognise that now is the worst possible time to freeze pay for our key workers? On schools, we all recognise the huge damage that closing schools will cause for many children and families. But the Prime Minister knew that closures might be necessary, so there should always have been a contingency plan. Up to 1.8 million children don't have access to a home computer, and 900,000 children live in households that rely on mobile internet connections. So can the Prime Minister tell us, when is the government going to get the laptops to those that need them? He's spoken about the 50,000 delivered and the 100,000 more, but 1.8 million children don't have access to a home computer. So there's real urgency needed now as we go into these weeks. I welcome what the Prime Minister said about telecoms companies cutting the cost of online learning. It's vital that they do so. I'm assuming that's happening straight away because we can't delay there. And will the Prime Minister be straight about what's going to happen with exams this year? We cannot leave this until months down the line. In particular, and very pressing now, for those who are meant to be taking their BTEC exams in the next few days. Surely they must just be cancelled. Some leadership on this is desperately needed. Next, Mr. Speaker, our borders. The Prime Minister knows there's real concern about the rapid transmission of this disease. There are new strains being detected in South Africa, Denmark and elsewhere. The quarantine system isn't working. The Prime Minister said yesterday that we will be bringing in extra measures at the border. I have to ask, why are those measures not introduced already? Exactly. They've been briefed to the media for days, but nothing has happened. Mr. Speaker, this is the third time the country's been asked to close its doors. We need to make sure it's the last. We will support the Prime Minister and the government in these measures. We will carry the message and do whatever is asked of us. But we will demand that the Prime Minister keeps his side of the bargain. Use this latest lockdown to support families, protect businesses, and get the vaccine rolled out as quickly and safely as possible. Thank you, Mr. Speaker.
Well, I thank the right honourable gentleman, who I think made some sensible points there, in addition to some slightly party political ones. And I just say on the political points, I think it is worth remembering that the waves of coronavirus that we've seen across Western Europe in the last few weeks, I'm afraid, we are also seeing here, with the additional pressure, Mr. Speaker, of the new variant of the virus. I think most people do understand that. He asked about support for the self-employed, and we've already given, I think, 13.7 billion to help the self-employed in particular, as part of a massive package of support for jobs and livelihoods across the whole of the UK, totalling 260 billion. Mr. Speaker, we will continue to support families through universal credit. There's been an uplift, as he knows, of £1,000 until at least until April. The eviction ban is under review. There's been above inflation pay increase for public sector workers. Nurses in particular have had a 12.8% increase over the last few years. He asked about laptops and devices, and he said that he quoted a figure of 50,000. In fact, the number is 560,000, Mr. Speaker, that have gone to schools. And my right honourable friend, the Secretary of State for Education, will be making a statement, as I said, later on, about what we're going to do to help support teachers and pupils. And again, I repeat my immense thanks to them, to families who are now working so hard in unexpected circumstances to teach kids at home. And I thank the mobile companies and the BBC again for what they're doing to assist. And he'll be hearing more later about about the BTEC exams, and obviously we must be fair to those who are taking BTECs as well. We appreciate the hard work that they have done. He asked about a good question about borders, and I think it's vital that we protect our borders and protect this country from the readmission of the virus from overseas, and that's why we took tough action in respect of South Africa when the new variant became apparent there, and we will continue to take whatever action is necessary to protect this country from the readmission of the virus. I'm grateful for the Right Honourable Gentleman's support in the vaccination programme. I must say I do remember the derision with which he attacked the vaccine task force and the efforts that they went to secure huge supplies. I remember it well as at Prime Minister's question time, Mr. Speaker. I think it would be a good thing if he could continue to keep up that spirit and point out that not only did this country devise the first effective treatment of COVID, secure the first approval, stage 3 approval of a vaccine, or the first to produce a vaccine that can be used at fridge temperature with great value to humanity across the world. And as I say, Mr. Speaker, the country that, as I stand before you today, has vaccinated more people than the rest of Europe combined. And I think it would be good to hear that from the gentleman opposite.
Let's head up to Epsom with Chris Grayling. Chris Grayling.
Thank you, Mr. Speaker. The Prime Minister is absolutely right to be taking the steps needed to protect the NHS in this very difficult time. I'm very grateful for the work being done by my local Epsom and St Helier Trust team. But the Prime Minister is also only too well aware of the thousands of businesses, many falling outside the scope of government support, which are facing desperate times. Many of us support the Prime Minister in what he's doing, but are very concerned that this House will not have an opportunity to take a further view on these regulations until the end of March. Will he give the House today an undertaking that he will personally lead a debate before February half-term on progress towards reducing restrictions, and that he will not wait until the end of March to do so, if it is possible to do so, without overwhelming the NHS?
Prime Minister.
Well, my right honourable friend is absolutely right to say that this House should, and I think will inevitably, be given an opportunity to debate and discuss these issues at a national level before the end of March, and I hope substantially before the end of March. What we're trying to do, as he knows, is to vaccinate the first 4 cohorts in the JCVI list by the middle of February. If we can do that, and if there is no new mutation in the virus, and if the vaccine programme proceeds as planned, then there will be, I believe, substantial opportunities for relaxing the restrictions. Schools will be our priority, as I've said, Mr. Speaker, and I've no doubt that the House will be consulted as you would expect, Mr. Speaker.
Let's head up to Scotland with the leader of the SNP, Ian Blackford. Ian Blackford.
Thank you, Mr. Speaker. Can I take the opportunity to wish you, all colleagues and members of staff, a good new year, and of course send my best wishes for a speedy recovery to the member for Cardiff Central. Mr. Speaker, I think people across these islands have entered into this new year feeling a mix of hope and fear. Hope that the vaccine will finally end this terrible pandemic, but real fear too about the increased cases, hospital admissions, and sadly, the lives lost. As our First Minister explained on Monday, this phase of the pandemic is now a race to suppress the virus and a race to vaccinate our most vulnerable. But if we are asking people for one last effort, if we are asking them to endure weeks of lockdown, then they need more clarity, they need protection, and they need financial support. Most importantly, the UK government has to act in a timely manner. It was said of the French designer Pierre Cardin that he was one step ahead of tomorrow. Nobody would say that this Prime Minister is one step ahead of tomorrow or acts and shows leadership in dealing with this health pandemic. The Prime Minister was slow to act in the spring of 2020, slow in the autumn, and here again reacts after the events to the threats that we all face. I want to ask the Prime Minister 4 specific questions on vaccines, on travel and financial support, and I would appreciate if he would answer each of them, not just for us, but for all the public that want answers. So firstly, on the vaccine, Professor Jonathan Van Tam said last month that the only thing that will slow vaccine availability are the fill and finish supplies, such as specialised vials. Can the Prime Minister tell us exactly what actions are being taken to ramp up these supplies? On travel, is the Prime Minister prepared to learn from his government's past mistakes? Will he consider closing the UK border to all but essential travel to prevent new strains of the virus spreading? On support for the self-employed, yesterday, why did the Chancellor again decide to exclude the 3 million freelancers and self-employed who haven't received a penny of financial support since the start of this crisis? They are desperate and they need help, and they expect the Prime Minister to respond today. And finally, on financial support for Scottish businesses. Yesterday morning, the Scottish Conservatives were busy making memes about an extra 375 million of Treasury support that they said was on its way to Scotland. Can the Prime Minister explain to Scottish businesses why, by the end of the day, it turned out there was no new money at all? Can the Prime Minister now give a personal commitment that the Scottish Government will get this money, this new money, for businesses in Scotland?
There's nothing if you want to the union.
Mr. Speaker, I'm grateful to the Right Honourable Gentleman. I just point out that on his questions about the self-employed, we have supplied, or as I said to the gentleman opposite, £30.7 billion already. We'll continue to support people in any way that we can with a multitude of grants and loans already totaling, I think, about £260 billion, as I've said. The Barnett consequentials for Scotland from the new money will, of course, be passed on. As I said just now, we will make sure that we protect our borders from the readmission of the virus, and he's seen what we did already in the case of the South African strain, and we'll bring forward further measures to stop the readmission of the virus. But I have to say, the general tenor of his question seemed to ignore the fact that I'm delighted to say that the whole of the UK has benefited massively from the strength of the natural strength of the UK economy, the ability of the UK Treasury to make these commitments, and the mere fact that Scotland, Wales, Northern Ireland, every part of the United Kingdom has received the virus is entirely thanks to the strength of our national, received the vaccine, is entirely thanks to our national NHS. And that is, I think that I think we'll make common ground with the Right Honourable Gentleman opposite. It is thanks to our United Kingdom NHS, thanks to the strength of UK companies, that we are able to distribute a life-saving vaccine across the whole of our country. And I think that is a point that he might bear in mind.
Yeah. Let's head up to Kenilworth with Jeremy Wright. Jeremy Wright.
Thank you very much, Mr. Speaker. Most of us do appreciate the difficulty of the judgments my right honourable friend is having to make. And can I thank him in particular for the access he's given members of this House to the government's medical and scientific advisors so we can understand them better. But would he agree that just as it's important that everyone understands the reasons why we've gone into a national lockdown, it's just as important that everyone understands the circumstances that will allow us to leave it? Can I therefore ask him, although I appreciate that he can't yet give a date, to be more definitive that when a specific point has been reached in the vaccination of priority groups, with the consequent reduction in the risks of hospitalizations and deaths, that then the balance of risk between health on the one hand and livelihoods and learning on the other will be significantly different, and that restrictions can be lifted?
Well, he's making a very important point that I know will be on the minds of everybody in the House, and everybody watching this can understand the kernel now of the debate. So let me, and I understand why he wants a more detailed timeline. I know that colleagues across the House would love to have a more detailed timeline. Let me try and repeat, I think what I can most sensibly say today. If our understanding of the virus doesn't change dramatically again as it has, if the vaccine takes effect, the vaccines take effect in the way that we think that they will, and the rollout continues to be successful. And above all, obviously, if everybody continues to play their part in following this lockdown and following the guidance to stay home, protect the NHS and save lives, then clearly at that moment on the 5th, around about the middle of February, 15th of February, when we have taken those 4 cohorts and immunised them, or shortly thereafter, there will be substantial opportunities to relax the restrictions that we currently face, if all those conditions are satisfied. And schools, as I say, Mr. Speaker, will clearly be the priority, and Mr. Speaker, the whole matter will quite properly be debated by this House of Commons.
Let's head to Surbiton with Ed Davey. Ed Davey.
Mr. Speaker, people are afraid and anxious. This lockdown should have come sooner, but we must all support it now and do all we can to vaccinate as many people as possible, as quickly as possible. But we also need more action to save people's jobs, their businesses, their livelihoods. Small businesses have shown incredible resilience, but now they worry whether they can survive another lockdown. And 3 million people, most of them self-employed, have been excluded from government support since the start, and the Prime Minister's answers today have not addressed that. Mr. Speaker, we must leave no one behind as we tackle this terrible virus. Employers and workers need support and certainty, and they need it now. So will the Prime Minister instruct the Chancellor to publish an emergency budget to include a business rates holiday next year, an extension to furlough at least until the summer, and support for every self-employed person in the UK, including those he has so far so unfairly excluded?
Prime Minister.
Well, Mr. Speaker, there will be a budget in the course of the next few weeks and months, as I'm sure he's aware. He's also aware that the government has made substantial cuts to business rates, to VAT, and has produced a package of £260 billion of support for businesses and jobs and livelihoods across the UK. And I repeat the points that I've made about the self-employed. I have massive sympathy with everybody who's facing a tough time at the moment. And I agree with him very much in what he said about the resilience of businesses. I think they are showing fantastic resilience under a huge amount of pressure. But the best way to help them now is for us, as I say, to follow this latest lockdown and get that vaccine rolled out and get our economy moving again in the way that we all want to. And the faster we can get through this period, the bigger the bounce back will be. And I'm confident that it will be a very, very substantial bounce back indeed.
Let's head up to Stoke-on-Trent Central with Joe Gideon. Joe Gideon.
Thank you, Mr. Speaker. Stoke-on-Trent is keen to play our part in the national vaccination programme. Our mass vaccination centre is ready and able to serve the residents of Stoke-on-Trent and North Staffordshire. However, it has not been scheduled to go live before the end of January. Can the Prime Minister ask the Health Secretary if this can be expedited if the supply of vaccines are available earlier?
Prime Minister.
Yes, indeed, Mr. Speaker, and I'll ask the Minister to write to her as soon as possible.
Let's head to Marianne with Liz Saville-Roberts. Liz Saville-Roberts.
Diolch yn fawr iawn, Llefarydd, and I also would like to send best wishes to the Member of Parliament for Cardiff Central, and sincere thanks to everybody working on the front line with the NHS at this time. Now, a Conservative Party newsletter recently told party members to say, the first thing that comes into your head, even if it's nonsense. Yesterday, it appears the Chancellor took on board this advice and unwrapped £227 million of already announced funding as new for Wales. This is, and I choose my words with extreme restraint, willful misrepresentation, which deliberately misinforms desperate businesses in Wales. Will the Prime Minister apologise on behalf of his Chancellor and recognise that for Welsh COVID measures to be most effective, there's an urgent need to lift financial borrowing constraints imposed on Wales by Westminster?
Well, I'm sure the right honourable lady, whom I have a keen regard, would not wish to accuse the Chancellor of willful misrepresentation, Mr. Speaker. But all the cash that we've announced obviously is passported on. The important thing is that the Labour government in Wales spends it sensibly, but the UK government is here to support businesses, jobs, livelihoods across the whole of the UK.
Can I just say while you're online, I'm not over happy with willful. I think we've got to think about the language we use within the chamber. These are times which are unprecedented, but I really do think members ought to be careful on the language they use. Secretary Batty Meriden.
Thank you, Mr. Speaker, and I thank the Prime Minister for his statement. I know he's had to take difficult decisions, and I understand why he's had to, and I fully support him. I am deeply concerned, however, about the impact of COVID-19 and lockdowns on our children and on our future generations, and especially those children who come from disadvantaged backgrounds. Does my right honourable friend share those concerns? And will he work with schools, especially the ones in my constituency, to make sure they get the IT support and laptops that they need so that we leave no child behind?
Prime Minister.
My honourable friend is absolutely right to raise that question, and that's why we're putting so much cash, 300 million, into help schools and young people continue with their education online. We've discussed already the role of the BBC and the mobile phone companies, internet providers in helping as well, and the 560,000 devices that we've already delivered as part of a programme of 1 million for the children that need them most, laptops, computers and other devices.
Let's head to Brighton Pavilion with Caroline Lucas. Caroline Lucas.
Thank you very much, Mr. Speaker. It's extraordinary that yet again the Prime Minister didn't say a word about the government's test, trace, isolate and support system. Vaccination and lockdown are essential tools, but they don't replace the need to trace infections and isolate cases to help break the chain of transmission. It is an enduring scandal that we still don't have an effective contact tracing system, despite a whopping £22 billion being thrown at private companies and consultants. So will the Prime Minister fix it, including by ensuring people can afford to self-isolate if they have to? Will he increase statutory sick pay, widen eligibility criteria so the nearly 2 million people locked out of it can finally benefit? Will he increase the value of support payments and offer hotel accommodation if people need it?
Prime Minister.
Well, Mr. Speaker, we've increased the support for those who are self-isolating and obviously increased the penalties for those who fail to do so when they're asked to do so by test and trace. It's an absolutely vital part of our fight against the disease. And what it has done, I think, which people don't appreciate, is it's actually allowed this country to have an incredibly detailed understanding of where the disease is and what kind of disease we're fighting. The UK is actually conducting 47% of all the genomic tests in the world to establish what is going on with the coronavirus and all its mutations. So NHS Test and Trace is a remarkable advance. Is it perfect? Of course it isn't, but it is also indispensable to our fight against the disease, as is, of course, people's self-isolation when they are contacted. You must self-isolate.
William Bragg.
Thank you, Mr. Speaker. Can I pay tribute to everybody at Stepping Hill Hospital and GPs across Stockport for their superb efforts in rolling out the vaccine, where all care home residents and those over the age of 80 will have received at least their first jab by the 15th of January. But will the Prime Minister ensure that he blasts away any bureaucratic barriers that are getting in the way and ensure that vital vials and other such equipment is in abundant supply? Because frankly, Mr. Speaker, there will be no excuses for any hindrance to this supreme national effort.
Prime Minister.
My honourable friend speaks entirely for me in what he says about the need to blast away bureaucratic obstructions, and I am proud to say at the moment that we've vaccinated more than any other country in Europe, indeed more than any other country in Europe put together. But that pace must not only be kept up, it must now, as the whole House can see, because everybody can do the maths, Mr. Speaker, it must now be accelerated. And we'll be saying more, Mr. Speaker, about how we propose to do that.
Samuel Wilson.
Thank you, Mr. Speaker. Prime Minister, for the third time in 9 months, the government has introduced a damaging lockdown policy which we know will cause thousands of businesses to go bankrupt, cost hundreds of thousands of jobs, damage children's education, lead the national debt to soar, remove basic liberties from people which we expect in a free democracy, all because the government says that we need, and the justification is we need to suppress the virus, protect the National Health Service, and to protect the vulnerable. Since those objectives were not achieved by the first 2 lockdowns, why does the Prime Minister believe that it will be achieved this time? Is there some firm evidence for it, or is it government just hoping it'll be third time lucky?
Prime Minister.
Well, Mr. Speaker, I don't think anybody in this House takes any pleasure, satisfaction, whatever, in what we're being forced to do. But the Honourable Gentleman should know that lockdowns like this are being conducted and have been conducted across the whole of Europe at the moment, or much of Western Europe, basically because we're all facing the same phenomenon, and basically because we have to protect our NHS and stop it from being overwhelmed. And actually, that is what the last lockdowns did. They did stop the NHS from being overtopped by the wave of the pandemic, and had that happened, I'm afraid the death toll would have been unconscionable, and that is why I think when he looks at what his constituents and what the public think about this, they know that overwhelmingly we are right to protect them, protect the NHS, and save lives.
Tom Hunt.
Mr. Speaker, I actually asked the people of Ipswich to come up with ideas for this question. The one I decided to go for was about the importance of grassroots sports clubs in Ipswich, particularly boxing clubs. In the summer I visited Patrick's Boxing Club, which got help in the first lockdown, but at the moment it is struggling. It's still got fixed costs, it's got its rent, it's got its utility bills, but it's still adding a burden. And also Unity FC Club and the Ipswich Kickboxing Academy as well, which has a fantastic jab not stab scheme to help combat crime and antisocial behaviour. Will the Prime Minister promise me that when he considers any further support for these crucial clubs that are based in the most deprived parts of the town that I have the honour of representing, that he takes into account not just the benefits for physical and mental health, but also the key role that they play, keep kids on the straight and narrow, keep them out of harm, keep them out of trouble, and make a fantastic contribution to our wonderful town?
Prime Minister.
Well, Mr. Speaker, Ipswich will of course be benefiting not just from kickboxing jabs, but from vaccination jabs as well, and that will enable us to get through this crisis all the faster. And I'm delighted by what he says, but we are supporting clubs such as the one he so eloquently describes by an extra £210 million to help wonderful community sports institutions such as Ipswich Kickboxing Academy throughout this pandemic.
We now go over to Jeremy Corbyn. Jeremy Corbyn.
Thank you, Mr. Speaker. Does the Prime Minister appreciate that the campaign against COVID does not fall equally on everyone in our society? For many, this third lockdown is one of devastating fear of mental health, isolation, job loss, poverty, loss of their place of residence, and stress about the future. So will he, at the very least, ensure that statutory sick pay is increased to £320 a week, the universal credit is not cut, that the continuation of the protection of private tenants goes on after the end of this lockdown, and that above all else, he ensures that every child in every school and every student has a chance to learn online by provision of a computer and, yes, free universal broadband for all in our society?
Minister.
I thank the right honourable gentleman, who seems to be really recapitulating what his right honourable colleague has already asked me, as though he was still doing his old job. But I don't necessarily want to repeat all the points that I've made. Obviously, we're investing heavily to support jobs and livelihoods throughout the country. On mental health, he's right to draw attention to the risk of increased suffering caused by the privations of lockdown. That's why we're investing hugely in mental health provision, another 13 billion plus 18 million support for wonderful mental health charities across the country.
So Desmond Swain.
Pubs can't compete with supermarkets for off sales. Even within a household, you can't play tennis or golf. Notwithstanding the assault on liberty and livelihoods, Why are these regulations pervaded by a pettifogging malice?
Prime Minister.
Pettifogging, yes. Malicious, no. Mr. Speaker, the intention, and I'm going to have to take the hit here. The intention is to stop the virus, to protect the NHS, and to save lives. And to do that, we have to engage in restricting transmission between human beings. And I know that my right honourable friends and colleagues, honourable right honourable members, will find all sorts of reasons to oppose all sorts of restrictions. But in the end, Mr. Speaker, we have to look at the overall budget of risk caused by transmission between members of the human race, and that is what we're trying to restrict.
Let's head up to Greater Manchester with Lucy Powell. Lucy Powell.
Thank you, Mr. Speaker. I've just come from a call with the big business organisations, and I know the Prime Minister is meeting with them later on. So let me give him the heads up. Businesses are on their knees. It's been a year of lost trade and mounting debts. Cash grants are welcome, but they're not enough, and most won't get them anyway. What they desperately want is not more sticking plasters, but a proper long-term plan to help them survive to the spring and then thrive beyond it. It can't wait until the budget because many will be bust by then. So can he urgently tell his Chancellor to come to this House with a proper plan for jobs and businesses? And please don't insult us by re-rehearsing what he's already done, because honestly, it's just not enough.
Prime Minister.
Well, Mr. Speaker, she asked for a timetable, as indeed many colleagues on both sides of the House have done so, and business rightly wants as much certainty as possible. I think what we have now, for the first time since this pandemic began, is clear sight of the end and the way to the end. And we've set a deadline, as she knows, of the middle of February, 15th of February, to vaccinate the first 4 cohorts. And she should, I'm sure she will appreciate that those groups comprise the overwhelming majority of those who have already, alas, died from COVID. So she will readily appreciate the implications of that for our ability to reopen our economy, and she will also understand, I hope, the implications that could have, if all the conditions that I've already described are satisfied, the implications that could have for businesses across the country. So I do believe there are real grounds now for them to be very hopeful and very confident about the months ahead.
Thank you, Mr. Speaker. Mr. Speaker, we've all seen the data, and people, normal people, really understand and do understand the need for this lockdown. But like so many people across this House, so many members opposite and on these benches, I worry about our economy, jobs, businesses, mental health, children's educational attainment. So perhaps the Prime Minister could tell us how normal people in Milton Keynes and beyond, will know that things are getting better.
Prime Minister.
Mr. Speaker, I thank my honourable friend, and he's absolutely right about people's feelings across the whole country. They want a sense of when they're going to get better, and I've tried to give that today. I really think with the pace of the vaccine rollout, if it can accelerate in the way that I think everybody would want, we will reach an important moment on the 15th of February, and as I've said many times in this House, I do believe things will be much better by the spring.
Let's head up to Warrington North with Charlotte Nittles. Charlotte Nittles.
Thank you, Mr. Speaker. Special schools weren't mentioned in the Prime Minister's speech, but they'll be remaining open over the course of lockdown. Can the Prime Minister please therefore advise the House what advice and support they have received to stay open safely for the often vulnerable young people who need them, and whether SEN school staff, students and their parents will be given priority access to the vaccine to keep them safe?
Prime Minister.
I thank SEN schools, their staff, parents, pupils for everything that they're doing, and all the work that's being done, by the way, by teachers across the country to continue to look after the children of key workers, vulnerable kids as well. And the point she makes about vaccination, which is one that I think many colleagues across the House have made, bringing forward the case for this or that group, I think it's vital that we as politicians leave that to the Joint Committee on Vaccination and Immunisation, who are driven by a desire to stamp out the disease as fast as possible and to reduce mortality.
Let's head to Surrey with Jeremy Hunt. Jeremy Hunt.
Thank you, Mr. Speaker. I fully support these measures and recognise just how difficult the decisions are. Before Christmas, we were told that testing was happening at the PHE facility at Porton Down that would tell us within a couple of weeks whether the vaccines worked against the new strain. I wonder whether the Prime Minister could update us on the latest on that. And if there is a glitch with the vaccine programme, are we implementing a plan B involving, for example, mass testing of high transmission areas, deprived communities, and so on, so that we can properly isolate as quickly as possible anyone who could transmit the virus?
Mr. Speaker, there is no reason to think that any new strain of the virus is vaccine resistant. And on his point about testing, I can say that mass lateral flow testing in communities across this country will continue to be rolled out because we still believe in its usefulness.
Let's head to Brentford with Ruth Cadbury. Ruth Cadbury.
Thank you, Mr. Speaker. As my right honourable friend, the Leader of the Opposition, said, whether it's on exams, financial support, border measures or test and trace, this government seems to sit and wait for the situation to reach boiling point before it acts. However, throughout the pandemic, most other governments have acted early and with clearly communicated contingency plans. So, will the Prime Minister acknowledge that the problem here is his wait-and-see leadership strategy and that he urgently needs to revise this so that the government can get a grip?
I thought I understood the Honourable Lady to be attacking the government's wait-and-see position on the vaccines, Mr. Speaker. But I really don't. Well, I really don't think that anybody in their right mind could accuse the government of moving too slowly in that respect. And indeed, I think she might add it to her script that this country has vaccinated more than any other country in Europe put together.
The great Brady.
Thank you, Mr. Speaker. I welcome the Prime Minister's assurance that this House will be consulted on the lifting of restrictions, should it be possible, before the end of March. But can I say to him that many of us are concerned at being asked to approve a lockdown which could continue until the 31st of March. Can I ask my right honourable friend to reconsider and to offer the House a vote at the end of January and at the end of February as well, not on whether to lift restrictions, but on whether to continue them or not?
Yeah.